When a couple cannot have a baby, who do you think gets blamed first? The woman, right? Yes. And this is because many people believe it's her fault. But do you know that infertility can affect both partners? In today's lesson, we are going to uncover all the whole truth about infertility, and I'm going to tell you all you need to know about this condition. So let's get started. What is infertility? Infertility is a medical condition that affects both partners, and this occurs when both partners are unable to achieve pregnancy within the period of 6 to 12 months of irregular unprotected sexual intercourse, especially when the mother is 35 years of age and below. Now let's move over to the types of infertility. There are two types of infertility, and this is where we have the primary infertility and the secondary infertility. Talking about the primary infertility, this is where this couple has never for once within this period, within this time frame, they have never achieved pregnancy, not even a miscarriage. Whereas talking about secondary infertility, this is where they are only able to achieve pregnancy just once, and then ever since then they have not conceived again. Now for a better understanding of this topic, I need to draw us a bit back so we can understand infertility better. Let's move back to how pregnancy occurs. For a pregnancy to occur, there must be ovulation. This means that the woman must be ovulating. There must be a healthy sperm to fertilize this egg. Fertilization must occur, and then this fertilized embryo must implant into the uterus. Now if by any mistake there is a problem in any of these stages that I have mentioned, it can actually contribute to infertility. Now let's move over to the causes of this infertility. Just like I've said before, that infertility can occur both partners. This means that there are causes in both partners. There are causes in the women, there are causes in the men. Now let's move over to the causes in the women. This is where we have the ovulation problems. This is where we have the uterine problems. This is where we have the fallopian tube blockage, and then the age. Talking about the ovulation problem, this examples is where this woman is having something like the thyroid diseases. There is hormonal imbalance. Then talking about the uterine problem, this is where we have the fibroid. Yes, I know that most of you might have heard that fibroid does not cause infertility, and you are right. It's just that there are different types of fibroid. Fibroid, as a result of a cause to this infertility, depends on the sizes, the location, and the type. The type that is related to this infertility problem is known as the submucosal fibroid. These are the type that grows inside the uterus and occupy space meant for the baby. Then we also have something like the scar tissues. We also have something like the congenital abnormalities. All these are under uterine problems. Then we have fallopian tube blockage, which can be as a result of endometriosis, and this is a condition where tissues similar to that of the lining of the uterus grows outside the uterus, and then they might actually grow beyond and then block the fallopian tube. We also have causes like the pelvic infection and previous surgery under this fallopian tube blockage. Then we have causes like the age. This when the woman is 35 years and above. Naturally, when a woman is age 35 and above, the fertility level begins to decline. And so let's talk about the causes when it comes to men. The main causes of this infertility. This is where we have the low sperm counts. This is where the sperm produced are being they are low in quantity. We have the poor sperm motility. This is where the mobility of the sperm is so low it can't swim fast to fertilize the egg. We also have causes such like the abnormal sperm appearance, the abnormal sperm shape. This can actually also be a cause of infertility. And we also have hormonal changes or hormonal problems. This is where there is low production of testosterone. But we have causes like the lifestyle changes. This is where there is excess use of alcohol. This is where there is obesity, smoking, exposure to some toxins, certain drugs, and can also be a cause of this condition. Now let's talk about the symptoms. We have the symptoms in men. Likewise, we have the symptoms in women too. Talking about the symptoms in women, this is where we have obviously there is no pregnancy. There is an inability to achieve a pregnancy. There might be something like the painful menstruation, irregular menses, absence of period. Then talking about that symptoms in the men, we have something like the testicle swelling. This is where the testes become so swollen. We have sexual dysfunction. We have the hormonal symptoms, and so on and so forth. Now let's talk about the risk factors for this condition. Which category of men and women are prone to having this condition. Talking about the category, talking about the risk factors for the women, we have women who are obese, women who are underweight, women who smokes, who uses alcohol, women who have endometriosis, women who have STI. Then talking about the men that are prone to having this condition, we have men who smoke, who are exposed to some certain kinds of toxins, chemicals, who uses certain drugs, men who uses excessive alcohol. Now let's talk about the diagnosis of this condition. How is it being diagnosed? For the female, the doctors diagnose this condition through medical histories, through the pelvic examination, through pelvic ultrasound, through testing for tubal blockage. We have testing for ovulation and so on and so forth. Then that of the men, you have something like the medical history, you have physical examination, you might even have semen analysis, and this is one of the most important testing for this infertility in men. Let's talk about the treatment options for this condition. Actually, there are different treatment options for this condition, and this is where we have something called the changes in lifestyle, when there is a limit to alcohol intake, when there is a cessation of smoking, when there is management of weight, when there is healthy diet, when there is treatment to infections early, and so on and so forth. Now let's talk about the surgery under the treatment option. Surgeries aim to remove fibroid, helps to correct endometriosis, and then helps to correct fallopian tube blockage. Then we also have treatments like the intrauterine insemination. This is where a prepared sperm is being placed directly into the uterus as a result of maybe its inability to swim so fast to fertilize the egg. Then we have something called the IVF, that is the in vitro fertilization. This is where this egg has to be like fertilized with a sperm in a laboratory, and then this fertilized embryo is being placed into the uterus. We also have treatment options like medicine, and this is usually for the women. We have medicine which can actually stimulate ovulation in women. Now, can infertility actually be prevented? Actually, there are causes which cannot be prevented, but fertility itself can be protected by limiting the alcohol intake, seeking for medical attention when there is a delay in conception, treatment of STI promptly, maintaining good weight, eating healthy, and so on and so forth. Now, let's talk about the misconception about this condition. There are many disbeliefs, there are many false information about this condition, and this include many people believe it's the woman's fault, and maybe as a result of the abortion she might have done in her youthful age. People believe it's as a result of punishment to all of this, but that's a lie. So there are some main factors contributing to this condition. Other people believe that once you have a baby once, that you can never have infertility, but that's not true. Secondary infertility is very common, and people also believe that once you have infertility, that means that you can never have a baby, but that's not true. Some conditions are treatable, and it can also improve if you seek for medical attention so early. Now let's move over to the nursing care given to a patient with this condition, and this include providing emotional support for this patient. You have to like encourage an evaluation for both partners. You will have to teach the treatment options and allow them to choose to make a choice. You would have to like address stress and anxiety, and you would have to like keep this patient's condition private and so confidential. Now we have gotten to the end of this topic. In summary, I would say that infertility is not just a woman's fault. It can affect both partners, but the good news is that some causes can actually be treated, especially when help is sought early. So if you are or you know someone who is struggling to have a baby, please don't keep silent. You have to like seek for medical attention and get evaluated. And then remember that infertility is a medical condition, and it is not a reason to get blamed or to get ashamed. And in addition, thank you for watching, and if you find this video helpful, please don't forget to like, share, and comment. And also don't forget to follow Nursing with Anita for more detailed, understandable health content. And don't also forget to leave your questions in the comment section. Bye, see you in my next video.